Can you see my slides?
Not yet. We're just seeing a blank. Oh, now we can
There we
see it.
go. Lovely. Okay. I will start. Okay. Hi, everyone. My name is Yoobin. I'm the CEO and co-founder at Quip Medical, and we're bringing the joy of medicine back to physicians. So I distinctly remember the day I became disillusioned with the field of medicine. It was my first day in clinic, and as a first-year medical student, I thought, today's the day that I get to talk to real patients. Today's the day I get to learn how to be a doctor. And instead, I learned how to write notes for the doctor. The reality of today is that the majority of physicians waste 50 hours per month on unpaid paperwork. Now, some physicians may want to take that time back to themselves, and others may want to see more patients. But I guarantee you, nobody wants to spend that time on the paperwork. So should physicians choose to fill that time with additional work, that is a lost opportunity of 150 patient consults per month. To put things into perspective, that's about $9,000 worth of a physician's time spent on something you don't need a medical degree for. And we want to fix that. Quip Medical has built the first true end-to-end clinical documentation ecosystem. It uses your patient encounter notes to automatically suggest all relevant billing codes and maximize physicians' profitability. We started by tackling the biggest problem of paperwork with our AI scribe, but realized that there was something missing. So we started building out features for post-consult paperwork, like referral note generation and after-visit summaries. Still, there were evident shortcomings of these AI scribes in the market. And that's when we dove deep into insurance and medical billing, a promising market with proven products that have set exciting precedents with acquisitions from large corporations. Existing solutions have tried to automate the note-taking or post-consult referral generation, and some have automated both, such as Mutual Health, Tally, and Scribeberry, to name a few. If you work in the health tech sector, maybe you've heard of billing support from platforms such as Dr. Bill or Dr. Care. At Quip, we've built all three. Not only do we follow the standard PIPEDA and PHIPAA regulations, providing end-to-end encryption of patient data, but unlike our competitors, we even go the extra mile by de-identifying transcripts prior to the generation of your notes. Furthermore, our aforementioned billing feature ensures that codes are limited to the context of the consultation and also guarantees that doctors aren't missing out on money that they should be getting paid. We are the first Canadian AI scribe to offer this additional feature. We're not just here to save physicians time, we are also here to save them money. To begin using Quip, doctors simply press the mic at the center of the screen to start a recording. From there, doctors can take the time to look at the patient and genuinely listen to their concerns without worrying about documenting the consultation simultaneously. At the end of the assessment, physicians stop the recording to initiate processing the summary note. The summary note is automatically synced to our web app from which physicians can seamlessly, sorry, I don't know why this isn't loading, from which they can seamlessly copy the note into their respective electronic medical records with one click. From our web app, physicians then have the option to retrieve all the relevant OHIP billing codes based on the scope of the note. At the end of the day, doctors are present, patients are happier, and notes are more precise. Our users are already seeing the benefits. Family doctors, nurse practitioners, and so many others have told us that they simply can't go back to the way things were. Those canceled dinner plans, missed good nights, poor patient rapport, all now prevented with the use of Quip. We currently have 30 beta users on our MVP platform across both Canada and the US, with zero churn thus far. In addition, we've recently partnered with the Department of Family Medicine at the University of Ottawa to pilot our technology. and this partnership alone allows us to service a potential pipeline of over 100 affiliated providers across the city. To date, we've generated more than 4,000 notes across 5 clinics, demonstrating a time saving of more than 400 hours in total. Now, despite our rapidly growing user base, we've been able to maintain a low unit cost of less than $2 per user, priming us well to scale in the near future. We currently offer 2 business models, depending on the consumer profile. For individual physicians or small clinics, we offer a monthly subscription model, while larger family health organizations or hospitals can contact us for a custom enterprise deal to negotiate annual licenses. From each of these models, we currently have an MRR of $2,000 with $50,000 more in ARR currently in the sales cycle with academic hospitals, making our projected MRR $6,000 by the end of 2024. With 5.2 million total potential users, encompassing physicians, nurse practitioners, physiotherapists, and other allied health professionals across North America, we are currently targeting a $9.4 billion serviceable attainable market with avenues to eventually target a $25 billion market globally in the near future. I would also like to take this moment to emphasize that these estimates are only expected to grow as we see a compound annual growth rate of 25% in the global digital health market. Looking forward, we plan to launch with more clinics and hospitals, as well as establish strong partnerships in complementary markets. Not only have we agreed to launch pilots, but we are also in talks to launch quality improvement and research studies, develop a French integration, and provide adaptations to use in retirement homes with the University of Ottawa. To support this, we've already begun integrations with Point Click Care, the #1 EMR for long-term care homes. Now, if you recall from the beginning of this pitch, I mentioned that we not only save physicians time, but also money. Yes, we've already built billing suggestions, but we're preparing to build something bigger. We plan to integrate direct claim submissions to the Ministry of Health and pivot our current subscription model to a commission model, thus A, lowering adoption friction from users, and B, increasing revenue potential by 3-fold per user. So we've already validated that we can build and sell Quip as is. But with your support, we can expand Quip's ecosystem with these features in the pipeline and expedite our market share in sectors listed here on the screen. Now, none of this would have been possible without our amazing team of engineers, all graduates from the University of Waterloo. Our CTO has years of experience and publications in AI research, as well as its applications, and currently leads the AI model development, evaluation, and other related tasks for Quip Medical. Furthermore, his experience working in the fintech sector equips us with the ideal skill set to push our product forward. Our software development team seamlessly integrates these models into our mobile and web app, and it is because of their expertise that we've successfully built all of our core technologies 100% in-house. We're the team to bring Quip to the forefront of health tech innovation, and we hope you'll join us on our journey. I think we can all assume that doctors like talking to patients, or at least most of them do. And if you're a family doctor, you like asking them about how the kids are doing, how that vacation was, or in my preceptor's case, about golfing. But as administrative burdens have continued to rise, this luxury of small talk has turned into a luxury that can no longer be afforded. I understand why documentation is important. In fact, it is essential to quality patient care. But with this technology available today, why are physicians still forced to remain glued to their monitors when they so desperately want to look at you, the patient? I didn't go to medical school to write notes all day. I came to help and connect with people. And I assure you that doctors feel the exact same way. Thank you.
Thanks, Yoobin. Your slides have come a long way since last week.
Thank you.
Oh. Okay, what do we start off with Melanie this time? Or sorry, Michelle this time.
Awesome. Great job, Yoobin. Okay, so I think some of the things that come to mind, when you're talking about how much it can save physicians time, I would definitely try to correlate that, and you did a few times, to like dollar amount of like 4,000. I think there was 400 plus hours, which would equate to X amount of potential money they could be generating from like having patients in that time versus like call it like $150 per patient. Like what does that kind of equate to? Just to give a sense of like how much like kind of, because that also shows like the money they could be generating as well as the time being saved. So that would be something I would include. In terms of I understood like the AI scribe piece. The automated billing wasn't super clear in terms of how that's being integrated into the system. Maybe I just need more background knowledge on that, but I would maybe kind of talk about those two features separately a little bit, and then because they're kind of distinct. And another thing I would maybe touch on is like, what does onboarding of this look like for a physician? Like, is this like a white label plug and play into their system? Does it attach to their EMR? Like, how does that work? Because I feel like a lot of pushback from physicians is like they already have so much going on, they don't have time to spend like learning this technology. They really need like a plug and play type scribe functionality. So those were some of the things that came to mind. Yeah, maybe I'll pause there. Some more things might come to mind as Lindy and Melanie ask more questions.
For sure.
All
Thank you.
right. Let's turn to the target market. Dr. Espina,
Definitely the target market. And
I'm very curious.
I definitely understand the experience of like, yeah, I would spend a full day in clinic and then another 2 to 4 hours either that night or the next day doing my notes. And so for a lot of the doctors, they do end up doing them at night. So it's not necessarily, and they don't want to work more, right? So for a lot of people, it's not that they're going to be earning more revenue by using the product, because they're not gonna, like, they don't want to work at night too. They're just gonna have more free time and just a better mental health, because they're not so angry all the time. Like that's where a lot of the value is going to come to, right? And that your free days are actually free days, and you can do other things like teach at the med school or whatever, instead of spending it filling out notes and paperwork. The EMR industry in Canada has been going through this like very steady consolidation of like Epic is taking all on the hospital and specialist EMR side. And then you've got TELUS, which is kind of taking all on the primary care side, just buying up everything. And then TELUS and Epic are going to go to war at some point when Epic comes for the primary care market. And so I think if you are something, right now it sounds like you're something that is kind of separate from those EMRs. We're cutting and pasting into them, but I think you do have to adjust that kind of elephant in the room and basically saying like, what is your plan for the future to ensure that one, like Epic and TELUS just don't completely reproduce what you've done. And guess what? Everyone's going to use that instead of your product because they're already using that EMR. Why would I pay 2 subscriptions? So either you plan to be bought by one of these two, or you're going to become so big and also do everything too that, because multiple subscriptions suck, right? We're already frustrated about all our streaming subscriptions to have to then be buying multiple subscriptions on that side. Like if I use you, can I get rid of my Dr. Bill subscription, which I have right now and I'm paying for, as well as my TELUS subscription, or is that just another one that I'm going to add on? I had some comments about like the pitch and the presentation itself, but I can't remember them. And I think I'm going to have to maybe at another pitch practice, see it again and go through that.
For sure. Very much appreciated. Thank you.
That's interesting, the distinction between, okay, I'm going to save time and therefore I can see more patients, or I can save time and therefore have a life.
Yeah, and some will try and see more patients, but there's very few who are going to say, oh, now I can book another half day of patients,
Yeah, interesting. Lindy, do you want to weigh in here? I know you've been part of this.
Yeah. Well, I was just going to say, so that last point is a really good one because you can capture the dollars saved in time saved, but then, and that's one metric. And then another way of talking about that same metric is to say, like, how many more hours you can then spend with your family and your hobbies and health and wellness and, you know, all of those things. And so I think that's a really good point to bear in mind. And also, we heard this last week as well, that it is worth considering whether the subscription model is going to be the best payment pathway for Quip Medical and AI Scribe, or whether, you know, it's at least worth exploring maybe some other potential ways to monetize. Because I think, as Melanie says, like, just, you know, the one more subscription, then that's one more thing that you think of getting rid of if you don't have to have it. Whereas if you can kind of, you know, put your phone down and it's automatically recording, and, you know, you're not really thinking of it because it's either been integrated and that payment is being processed by some other provider, or it's a transaction fee or something like that, that can smooth out the friction. So those are just a couple of substantive points that I wanted to echo. So we take that away. And then again, I think, you know, the pitch is just getting better and better each week. So congratulations.
I mean, I do have a great coach, so
Yeah, it sure is getting better, Yoobin.
thank you. Sorry,
Right.
Melanie, I had one question about what you said about Epic, because I learned today from my preceptor that Epic allows you to bill directly on their platform, but it's specialty dependent. So she's still using Excel. Like, she has to manually input all of her patients individually, send that Excel sheet to somebody who bills for the hospital. But in Emerge, you can bill directly on Epic. So I was wondering if you had any insight into
Yeah,
that.
I'm not familiar with billing on Epic. I do more primary care, so I'm used to more doing it with TELUS.
Okay.
I've used the TELUS CHR, Collaborative Health Record. And so I kind of fill out my billing at the bottom of the patient note, and then it gets sent to Dr. Bill. And then I have to go into, which is mdbilling.ca now. Then I have to go into the mdbilling.ca website, and I then have to, like, hit the button to kind of save it and submit it, which is an extra step that I hate, because every now and then I would forget to do that step. I would miss the deadline and I wouldn't get paid for a month
Oh, you're
because I,
kidding.
because I forgot to do the second step of going into MD billing. Like, as we've been talking, I actually just opened it to check to make sure that I had submitted my last billing, because so definitely, like, getting rid of billing headaches is the ideal. And I know, like, my husband will spend the evening at the table entering all his billing in off a piece of paper, like you're kind of talking about, for somewhere where he works where there isn't Epic. But yeah, but again, I don't know that your product would fix his problem because he's doing something different.
Right. Because I also heard from most primary care doctors that they can submit bills directly through PS Suite without needing to use Dr. Bill.
Yeah, I mean, I'm not sure how PS Suite works, but I think they still have to go into the back end like I do, just to kind of
Okay.
submit it after, like, it gets submitted from PS Suite, but then I still think you have to go into your dashboard in mdbilling.ca, but maybe not. Maybe, yeah, check with one of the preceptors.
That's cool. It sounds like such a headache.
It's a pain, and it's painful because it's like, yeah, okay, I get like $36 for this, and 23% of that goes to my clinic for overhead, right?
Right.
So there's not a lot of leftover money. So if I'm also paying for your subscription out of that, you know, is it added into my clinic overhead because they've got a larger subscription for everyone in the clinic, which is how my CHR gets paid for? Or is it something I'm paying for separately on my own, like my Dr. Bill that I'm paying for? So
Yeah. No, that makes a lot of sense. Thank you for that.
no
So
problem.
that's a good question, Yoobin. So are you, to Melanie's point there, is it a clinic that you're expecting to pay for it, or the individual physicians?
Yeah, so ideally it would be the individual, or it would be the clinics that would pay for it. As Melanie mentioned, physicians pay enough overhead as it is. And our long-term goal, I briefly touched on this, but I think based on the feedback, definitely need to highlight it better. We want to basically do everything Dr. Bill is doing, but also offer you that AI scribe component. So we're like blending these two separate markets and finding the intersection, and making that like our distinctive feature. And so ideally in the future, you won't need to pay for both. It would just be Quip that you would be paying for. That would be included in the overhead.
Got it.
So it's interesting that your business then is like, we're an AI scribe company, but we're coming for MD billing, right? Like we're going to try and put MD billing out of business, but you're marketing yourself right now as this AI scribe. So maybe just not decide who you are, because like you can do both, but in the way you communicate what your product is.
Definitely need to make that more clear.
Have that in there.
And one thing just adding on to that is like, be really specific with how you're better than kind of both. Because when like Tally's actually a company like we've looked into, and I'm just wondering how your guys' AI scribe, like, is it summarizing the notes? Is it like putting the notes directly into all the reports that need to be submitted? Like what features is it doing compared to the competitors that makes it better? And then, and we're also doing all the features that the billing side does. So yeah, they're carving out what space you want to play in and how you're better than both. Because it's tough to beat in all the markets.
Yeah. I guess, sorry, I know I'm asking a lot of questions, but if we want to try and frame it in a way as, right now we're primarily an AI scribe, but all of the information you need to figure out what billing codes are required or that need to be submitted, that's all in the note. So that's why we're able to pull the optimal billing codes for each consultation. We're not directly integrated with the Ministry of Health yet. So that's what our future goal is. But I'm trying to balance what we currently have and what we expect to be in the future. And I don't want to confuse them. I also want to make sure that our message comes off clearly. So I feel like that's the part I've been kind of struggling with.
Some ways I've seen other founders show it is on a slide of like, it pops up of like, here's what we're doing now. And then like a second piece of the slide comes up in like a lighter color, whatever, and showing like, and here's where we're going to be. And like with kind of a timeline on the bottom. And then that, to me, I find that really easy to digest of like, okay, here's where they are, but here's the vision of like the product roadmap of what they want to be at and like how they're building towards it. And then it also opens the floor of like questions they can ask about it, but that might be a like visual way to show it.
Okay, no, that's a really good idea. Thank you.
Don't apologize for asking questions, Yoobin. This time's for you.
I appreciate it. Also, Jane, could you let me know how long that pitch was? I forgot to time.
Yes, 8, 9, 10 minutes.
10 minutes? Okay, sounds good. Hey.
I'll put that on your form with the notes.
Thank you. Okay.
Any other questions? We've got 15 minutes with these experienced people.
Melanie, if you don't mind, could I maybe reach out to you about your experience with Dr. Bill after this meeting?
Sure. Yeah.
Okay, thank you so much. But yeah, I think those are the main questions that I had for this session.
All right. Great job. And we all learned a lot. I learned a lot today. Okay. All right. Thanks, Yoobin, for the great presentation. And thanks, Melanie, Michelle, and Lindy, all for joining today. Really appreciate great feedback.
Thanks
Take
so
care,
much.
everyone.
Have a great weekend, everyone.
Have a great weekend. Bye.
Thanks. Bye.